Hi everyone, this is Murali Rajkonda, American Oncology Institute, Vijayawada. Today we are going to have a cancer awareness session with Dr. Saikrishna Kolluru. He is a medical oncologist, Haemato Oncologist, Paediatric Oncologist and Bone Marrow Transplant Specialist at American Oncology Institute, Kannuru, Vijayawada. Hi sir.
Understanding. This is Dr. Saikrishna Kolluru. I am a consultant medical oncologist at American Oncology Institute, Kannuru, Vijayawada.
Hi doctor, welcome to the show.
Thank you.
The first question is cancer preventable?
So, regarding prevention of cancer, most of the cancers occurs because of the risk factors. So, many cancers like risk factors like smoking, obesity, and sedentary lifestyles. These are all the common risk factors for many of the cancers like breast cancer, or ovarian cancer, and many cancers. So, if you have a cessation of smoking or a proper exercise and an active lifestyle and a healthy lifestyle, there are so many cancers that can be preventable. So,
can cancer be diagnosed without symptoms?
yeah, there is a procedure called screening. So, if any population in the population, even if they are not having any symptoms, we can always identify some of the cancers. For example, there is a test called mammogram. Mammogram is a kind of digital X-ray of both the breast. It has a capacity to diagnose breast cancer even without symptoms. So, similarly, there are many cancers which can have a screening test, like a CA-125 blood test for ovarian cancer or a serum prostate-specific antigen for carcinoma of prostate. Likewise, there are many tests that can be diagnosed with the screening without even patients having any symptoms.
Okay. Is cancer curable?
So, there are cancers like even early stages of any cancer can be curable, that can give even 100% survival to all the patients. And even some of the cancers like blood cancers, if you take acute leukemias, and also there are some kind of cancers like testicular cancers and advanced ovarian cancer, which can have even curative intent. That means we will do all the kinds of therapies like chemotherapies or surgeries, or we will do whatever possible options we will have, and we will try to get the cancer cured. So blood cancers and testicular cancers, even when they are presenting at advanced stage, they can be curable. So the one thing that we need always remember is always prevention is better than cure. That means if you diagnose it early, you can cure it early.
Is there any vaccination to cure cancer?
So many patients will be coming to the OPD, and these days they are asking like, doctor, is there a vaccine to cure cancer, or is there a vaccine to prevent cancer? So there are two entities. So as of now, current standard of guidelines, there is no vaccine to cure the cancer, but you can always prevent the cancer by vaccination. For example, a cervical cancer vaccine will prevent like Gardasil, Subbiotics like human papillomavirus vaccinations can prevent cervical cancer. At the same time, hepatitis B vaccination has a potential to prevent the hepatocellular carcinoma. Likewise, there are limited kinds of vaccines that can have potential to prevent the cancer, but not curable as of now.
Does all cancers occur in family?
So this is the common question. People will come to the hospital, like patient attendants will keep on asking like whether there is increased risk of cancer in the family members. So there are particularly some 5 kinds of cancers where the risk of cancer is more in the next succeeding generations. For example, breast cancer, ovarian cancer, pancreatic cancer, and colon cancers. Most of the times they will be having a familial predisposition to the cancer because of the mutations in the genomic alterations. So these can be diagnosed with the proper kinds of genetic testing and genetic counseling, and also there are some kinds of germline testing for all these types of cancers.
Does cancer is age related?
So one question previously it was thought that cancers, most of the times cancers can occur in the elderly age group populations. If you take one example, so prostate cancer is, the risk of prostate cancer will keep doubling with the increasing age. But it is not like all the cancers, because there are many cancers that can occur in the pediatric age group also, like lymphomas, leukemias, some kinds of blood cancers, or even a Wilms tumor, neuroblastoma. These kinds of cancers can occur in the pediatric population, that means childhood. And some kinds of cancers like even breast cancers can occur even in the early age group like adolescent girls, and also many of the cancers will occur after 50 years of age.
what are the treatment options other than surgery and radiation for cancer?
So most of the cancers will be having either surgery or a radiation or a chemotherapy option. So chemotherapy, one of the myth commonly population will be having is chemotherapy is most of the times it is hazardous and it is always involving like IV cannulas and all. So one thing I just wanted to tell you all is chemotherapy is nothing but it has two forms. It can be given through an injection or it can be given through a tablet. So there are many kinds of advanced therapies in the medical oncology now, including chemotherapy, targeted therapy and immunotherapy. So the latest advances when compared to previous decades of cancer treatment were these targeted and immunotherapies have been advanced. That means a simple tablet like some of the tablets with a mutation positive lung cancer can extend the survival. That means if a patient with lung cancer is having a significant mutation, that can always be targetable. At the same time, a patient with having some of the PD-L1 receptor status, that means there is a therapy called immunotherapy. Immunotherapy itself is, it will act to stimulate our immune system and that will start our own immune system will fight against the cancer cells. So these kinds of advanced therapies are available now and these will help to extend the survival of the even advanced stage cancers also.
Yes.
Yeah.
Thank you, doctor. Thanks for giving more information about cancer and such a wonderful session with you, sir.
Thank you.
Thank you. Thanks for watching live session. And if you have any questions and queries, please comment on our chat box. And if you want more videos about cancer, please subscribe our channel, American Oncology Institute. Thank you.